Imagine being a young bride, eager to start a family, only to discover that you are sterile and cannot conceive. To add insult to injury, imagine being pregnant with your first child and suddenly being faced with a preterm high-risk birth due to an infection you never knew you had. Having been a medical assistant in the field of obstetrics and gynecology for the past 3 years, I have seen firsthand the distress that can be caused by sexually transmitted diseases in young women. I want to target the group that's most affected by these sexually transmitted diseases. Women aged 15 to 19 continue to report the highest infection rates of gonorrhea, chlamydia, and trichomoniasis, 3 common STDs. I hope to educate young people about the risks associated with these diseases, proper treatments, and prevention of these infections. Gonorrhea is a bacterial infection. It is spread through vaginal, oral, or anal sex. Sometimes individuals may have no signs or symptoms of infection. When symptoms are present, they may include discharge, burning during urination, or itching around the sex organs. If the disease was contracted during anal or oral sex, the anus may hurt or burn and have a discharge, and the throat may become sore. Gonorrhea is treated with an injection of antibiotics. Chlamydia is also a bacterial infection that is transmitted through vaginal, oral, or anal sex. Most women do not have symptoms of chlamydia, but when they are present, they may include frequent burning during urination and unusual discharge. The treatment for chlamydia is an oral antibiotic. Trichomoniasis, or trich, is a type of vaginitis that is a true STD. While other forms of vaginitis are not sexually transmitted, trich is. Trich can present with a frothy yellow or green discharge and may be malodorous. It may also cause burning and itching or swelling of the vagina. Trich is treated with an oral round of antibiotics as well. In the CDC's STD surveillance report from 2008, the Centers for Disease Control concluded that ladies aged 15 to 19 continue to have the highest rate of chlamydia compared to any other age group. The infection rates increased from 9.8%, which is 2,982.5 per 100,000, to 3,275.8 per 100,000 in 2008. The CDC also concluded in their report that this same age group experienced the highest number of infections of gonorrhea, some 636.8 per 100,000. Although this number decreased 1% from 2007, this age group still led all other age groups for this infection for the past 4 years. While the numbers on trichomoniasis are not as clear, the cases that have been reported still predominantly come from the 15 to 19-year-old female age group. The CDC contributes the higher rates of infection in the adolescent age group to multiple barriers that prevent these young ladies from receiving the treatment that they need. Some of these barriers include lack of insurance, inability to pay, and confidentiality issues. It is estimated that 15 to 19-year-olds contract 1/2 of all new sexually transmitted diseases, while they only make up 25% of the sexually active population. I wanted to retrieve some data closer to home in our own demographic, and having studied our own patients from the years 2009 to present, of the 93 OB patients aged 15 to 19, 23 were infected with gonorrhea, chlamydia, and in some instances, both. Gonorrhea and chlamydia left untreated can develop into PID, or pelvic inflammatory disease. This can scar the reproductive organs in men and women, leading to infertility. Untreated trich in pregnant women can cause premature rupture of membranes and lead to preterm birth. Finally, to abstain is the only foolproof method of being sure you will not contract any sexually transmitted diseases. If you do decide to engage in sexual activity, get regular gynecological exams. The STDs I have mentioned are curable. There are many, many more that are uncurable and will affect the rest of your life. Be responsible for your own health. Insist on proper condom usage every time and limit your partners. Remember, your future is in your hands.